on the line. But that was the only thing that reassured me. Then I told them one glimmer of hope. There might be a chance that if you can prove that you're a 5-day-a-week employee who's paid payroll taxes on 5 days a week, and now your workplace is only giving you 2 days of worth of work, they're willing to compensate you for the remaining 3 days. So unemployment might come through. This is the time for Trump to come through and the politicians to come through.
But this is for
And
the
make
people
it
working in the regular industry,
right.
not the.
It doesn't count for people who are like, whose employer has more than 500 employees.
More than 500.
They will get amazing bailouts, I promise you. They will probably be.
Well, the question is,
yeah?
will it get trickled down to the end user, you know?
And that would be sad if that didn't happen.
So hopefully, you know, anybody who's got over 500.
I would hope people like Boeing, when they have to close out,
Yeah.
they will use some of that to keep their employees paid.
Right.
They're already a mess before.
I know.
They're worse than
They're looking for a
that.
bailout.
Yeah.
That's what
I don't know
it
about
is.
that.
They were like, thank God, it's some excuse to get a bailout.
Bailout.
I didn't know, but most airlines have only 2 weeks of reserve if they go complete shutdown.
Right.
Really?
Most airlines.
Goes to show, none of us is really savvy about this. Not the big industries.
Who expects you to be complete shutdown? It's very rare.
Yeah. Well, I
It's probably
think
the first
this
time in
is a good
history.
test
But
for
still,
the
should you
system,
not have
know?
it?
That's right.
If something-
Always have at
something-
least a couple of months worth of reserves in a
No,
reserve
these guys run
account?
on very slim margins, right? Airlines are
Could do whatever you want, whatever.
2%, 3% margins, and not big reserves. So we shut down. So hospitals obviously will not shut down, but the airlines and the hospitality industry,
Yeah.
Wonder what's gonna happen
or
in
even
this country.
restaurants,
Yeah, they're hurting.
the margins are very slim.
But this is a good test for the system though, you know, because if something, you know, even though this is bad, but I think it could be worse, you
Technical
know.
problems.
It
Yeah,
could be worse, you know, this
Facebook is fine.
exposes
The
our
YouTube one,
flaws
you know,
in the system.
yeah,
Why don't we have
it's
issues,
so
why don't we
there's
have
a
enough training,
time.
all the stuff that needs to be addressed in the next epidemic.
Oh yeah, that's just like a tsunami. We never thought it ever happened in a lifetime. Then suddenly you have this, now everyone is now
Right.
aware, they have all these early warning systems and, you know, same way, I guess this will call for change and all that.
Now double down.
It's definitely gonna go down in the history
But I
books.
don't know why Facebook share is.
I think we will all remember
After the
where we
Spanish
were,
flu,
spring of 2020.
Ah, yeah, I guess maybe.
Just like 9/11.
Mm-hmm.
Yeah.
Yeah, exactly where you live.
You done by already? No, it's saying 0 0. Oh, okay.
Yeah.
Send that to Ram and I will shoot on there is a WhatsApp open.
I think there are now 80 cases now in South Carolina.
125,
25
26.
26.
In South Carolina.
Yeah.
3 deaths.
Three times. None in the upstate so far.
No death in the upstate. Florence, Kershaw, and Richland.
That's where it started, right? Is that where they,
Mhm.
so it's just a matter of
Matter
time.
And all 3 were assisted living, nursing home kind of situations.
It's funny, there was a death in Florence, but I have some friends that live in Florence, and a lot of people are posting stuff, oh, they went to get their hair done, they went to get their nails done,
Different things,
they
yeah.
went to do like some
Okay,
group
that's
party.
good.
Like, what are you guys
Facebook is
doing?
not gonna.
Well, that's why, you know, the government's gonna have to, you
Go
know,
there.
we just saw a video yesterday where the US, they were gonna do the lockdown or something like that.
Yeah.
Facebook is
And
on.
Trump said no, there would be no lockdown for
You
right
said no,
now.
no nationwide.
Yeah, nationwide.
But I
think they're
honestly
picking
think that
cities.
might be needed.
Just at least for a week or two. That's probably
For a
better
week.
than kind
Yeah.
of prolonging the.
Agony, right?
Yeah.
This was funny.
Nothing in life in front of the TV. That's true. And the six-pack beer guys is the way to go now. Sit in front of the
This is
TV.
why I'll be busy, they'll all drink, they'll all get paid.
And then come back afterwards.
Now we have a
And then you will be busy,
separately.
okay?
Well, you know, you had the toilet paper, you know, run out. and-
And I was like, it was like really weird. Why toilet paper? It's like, you know, you get the coronavirus, but
Well, all
you
Indians
die
are-
with your butt clean.
All Indians are thinking that, right? They're like,
Organize your
we
mind
don't
out."
understand that. you know?
We don't, yeah.
Just my own sleep right, you know?
There are people,
As long
one
as
day
you
she
have
said,
water.
I may have to use Depends, and I'm like, why? Because there's no toilet paper, and I'm thinking, I still don't understand that, why would you need Depends?
Right.
And then there was somebody that said, I will take a shower. I was like, oh, you don't have to go that extreme.
Right, right. They can't comprehend the fact that.
Look at that, Gulzar is murdered. Are you guys watching IAG's Corona panel discussion? Is it coming on yet?
Yeah, right. So Shiv, now you refresh your Shiv.
I'll tell her, we'll start in a bit. I'll surprise her.
Indian Standard Time.
That's right. Never fails.
Does light have to be like directly on our face?
No, it doesn't matter.
Move up a bit or?
I'll check the We're live.
So are you facing the
Are you
camera
live
when
now?
you speak or?
Yes, you are.
Okay, hey everybody. Welcome to this forum that IAG has organized for all of us. Thank you, Sanjay Talur, the president of IAG, for organizing this. Hopefully something good will come out of it today, and even if one person benefits from the knowledge we share today, it would be wonderful. We're at a very odd time of history. Chances are we'll all remember what we were doing spring of 2020 because of this particular episode. Countries like Italy will probably have a hard time recovering for a while. I wonder about our own future and our recovery, but I do honestly believe there's a better future out there. We will overcome this. So let me tell you what we're going to do today. We have a panel of 5 physicians, and each one of those physicians brings a different strength to this panel. Please feel free to send in your questions later on through the YouTube medium, the Facebook, or even you can call, obviously, yeah? We'll try and answer the questions to the best of our abilities. We're obviously practicing physicians. We're trying to help the community, so we may not know everything on every issue, but we promise you we will get back to you with the correct answers. And one thing I need to mention, even before I introduce my panel, is that the opinions we give here are truly ours. They do not reflect on the places we work or we associate with. So keep that in mind. And I would like to introduce Dr. Ravi Patel. He is an emergency room specialist, and he practices out of Prisma Health Systems Lawrence Emergency Room. We have Dr. Nancy Patel, and Dr. Nancy Patel is a pulmonologist, critical care specialist in private practice. Big association is with Prisma Health Systems at the Lawrence Hospital, but she also dabbles at Spartanburg Regional sometimes. We have Dr. Viral Oza, who is new to Greenville. He's a gastroenterologist, an interventional gastroenterologist who's working at Prisma Hospital Systems. Welcome to this panel, Dr. Oza. And he will talk to us about how it impacts physicians and providers beyond the ones that are actively involved. We obviously have Dr. Santosh Bijur, who's a hospitalist who has been working at Spartanburg Regional and Anderson's Regional Hospital. I myself, I'm Vinita Srivastav, and I practice internal medicine, outpatient medicine, and sleep medicine at Peace Medical Centers at our 2 different locations. I'm affiliated with St. Francis and also with Greenville Hospital System. So between all of us, we bring you updates from what Spartanburg Regional might be doing and thinking, Prisma might be thinking and doing, and Anderson. And a little bit of reflection from me from what St. Francis is warning me and telling me about. So now, without much ado, I do really want to go on to getting our panelists to speak on different aspects of the so let me start with you, Nancy. Nancy, what are you seeing? Are you seeing patients already that might have symptoms suggestive? Do you suspect, do we have a scenario bigger than what we think we have?
So yes, we are seeing cases where we are, obviously ruling out COVID-19. The symptoms are somewhat challenging in the patient population that I see on a normal basis, where most of my patients do have shortness of breath, COPD, asthma, etc.
Yes.
So when they come in with their normal flares of, hey, I can't breathe, once again, we do go down the pathway of trying to rule them out. Obviously, testing has been limited, and that's delayed some of the care and
Yes.
some of the problem there. And so I do believe personally that there might be cases out there that just are not being reported because of the delay in the testing.
So for those of you that didn't catch it, that was Dr. Nancy Patel, pulmonologist, critical care, telling us that there is a bigger problem than we imagine. Let me ask a question of Dr. Ravi Patel. Dr. Ravi, what is the emergency rooms doing? Are we in the upstate at a point where we feel comfortable and confident?
Well, I can speak for what we're doing right now as far as Prisma Health. You know, they have a tent set upside at Greenville Memorial, and those folks can go there with an prescription order, and that's all they can test for is COVID-19, which gets sent to DHEC, and it's about a 3 to 5 day turnaround for that test. Now, that's only for symptomatic patients that a doctor deems necessary to get tested for. Now, so all the hospitals are gearing up. Obviously, we spoke earlier that North Greenville is turning into a COVID-19 hospital dedicated to just those patients. So we are gearing up as far as, getting prepared at all the satellites as well.
Okay. At Prisma, at Lawrence, where you're working, you guys are making some additional measures to prepare for those cases, the onslaught of cases that we anticipate?
We are. We're in the process of probably setting up a tent outside as well,
Yeah.
to kind of prevent needless exposure to other staff.
Mhm.
Just to have exposure to staff that's properly protected with gowns and mask and et cetera. So we have an algorithm that we go down as far as who needs to be tested, who needs to be admitted, who can go home safely and isolate themselves until further testing is available more throughout the PCP's offices and the hospitals. We have to kind of follow those guidelines.
Santosh, you being a hospitalist at these two different hospitals, you probably have a good idea of what is being admitted and what patients are coming to the hospital, getting admitted. Are you seeing cases where you might think you're dealing with COVID-19? Is that something?
Yes, we are seeing cases that are what we call PUI, that is patients under investigation.
Yeah.
So if they have minor symptoms in the ER, as Dr. Patel mentioned, that they test them and send them home and ask them to self-quarantine and follow the PPE procedures that they can do at home. If they have moderate symptoms or if they have comorbid conditions, if they have diabetes, they have COPD, they have any cardiovascular conditions like congestive heart failure, and then they have these symptoms, fever, cough, shortness of breath, sneezing, sort of quote-unquote cold/influenza kind of symptoms, we admit them.
Yes.
Depending on how their respiratory status is, we either put them in intermediate or severe, depending on if they have a severe infection. And then we go follow an algorithm that kind of tells us how we follow the procedure. We have them isolated in one wing of the hospital right now.
Okay.
And but if we do unfortunately see a surge of cases, we may have to open certain other places in the hospital where we will start.
So for right now, Spartanburg Regional and Anderson have dedicated a floor to COVID-19 suspected patients or patients under investigation, right?
Yes.
And you were talking about North Greenville being dedicated by Prisma as their COVID-19 hospital. So I'm glad certain steps are being made to anticipate and work with that. Dr. Oza, what is you are practicing at Prisma, you are still seeing patients for other conditions. What are you seeing and hearing at the hospital beyond what the physicians that are actively involved?
So, I'm a gastroenterologist, and as a gastroenterologist, what we have done at Prisma in our clinics is we have decided to cancel a lot of the elective cases that are, so for example, things like screening colonoscopies or really any elective cases which don't have to be done in the very quickly or on an emergent basis. And those cases are rescheduled. We're contacting our patients and letting them know. And this is happening, I think, across all specialties, not just gastroenterology specialty. As far as clinics are concerned, I think, again, across all specialties, a lot of providers are shifting towards telehealth. So having a discussion with patients through kind of like what we're doing right now, with video, having a conversation with the patients about whatever is going on, whatever their conditions are. And even we are able to do everything, even we can prescribe medications electronically. So it's not really limiting us that much, but yes, it does limit our in-person interaction. That's really necessary to minimize exposure to hospital staff, hospital workers, but also it necessitates minimizing exposure to patients who might be at high risk, who might be coming in. Now, patients who absolutely have to be seen in clinic, we are still seeing them. We just ask that if they are having some of the symptoms of COVID-19, then they let us know up front before they come, so we can triage them appropriately. And if they need to be seen, then we can see them in the right area.
So Dr. Oza, you're reminding us that if a patient is sick and needs to be seen for a non-emergent procedure, obviously if they have symptoms that suggest COVID-19, inform the doctor that you're doing the procedure with, and you're trying to reschedule totally elective colonoscopies to a future day.
Colonoscopies, endoscopies, everything that's elective.
Colonoscopies, endoscopies, but the other stuff that people need absolutely, like we were talking, your cancer patient that has to have that stent removed, you're proceeding on with that. Is that correct? I'm getting
It's
it.
also a case-by-case basis. Sometimes you can actually be delayed by a couple of weeks. In those cases, yes, we are delaying them.
Yeah.
But if it needs to be done
Then-
sooner rather than later, then we do it in the safest manner possible.
So the basic things that we're all hearing from everybody is, of course, that the hospitals are prepared, that the doctor's offices are prepared. Now, I take care of a good bit of 3,000, close to 3,000 patients in an outpatient setting. So I will tell you guys what I am seeing in the outpatient setting. Obviously, I'm seeing a lot of panic. I have patients that are scared, that are calling me, do I have COVID-19? And they absolutely have no symptom. I'm seeing patients with cold and allergy symptoms who are concerned, do I have COVID-19? And honestly, there's a couple of patients that came in and who did not ask me if they had COVID-19, but when I examined them, I was confident they had COVID-19 or something similar to that. And to give you all an idea, in January, I saw a few cases that I thought were hard to treat, upper respiratory tract infections. Looking back, we might have dealt with COVID-19 at that point. Obviously, I have no basis to say this, but I'm thinking that might have been the case. So in the outpatient setting, I'm seeing patients, but I'm having to make a shift. I'm shifting the way I do it. Every patient that's sick calls our office. We tell them to either come to the office or we're treating them by telehealth. If they come to the office, they're waiting in the car, I examine them in the car or in my contamination room. And if I sense that this could be a positive, I send them to the south deck of Prisma's parking main complex, the 701 Grove Road complex. That's where I've been sending the patients for testing. Obviously, since I've seen and they have a valid order, the south deck physicians are able to perform the tests. But what my suggestion to all my patients has been, call us if you think you have symptoms. Call us. We can talk to you. If you're anxious and worried, call us. We can tell you if you have a reason for concern. But the big thing I want you to take from this is that there is a future out there. Now, I do want to get started with some questions. Are there any obvious questions that have come in? Let me take a look. And remember, guys, please forward your questions. We're here to help you with those questions, very much with those questions. The first question we have from somebody is, do we have enough stocks of hydrochloroquine in the United States? And can this be used as prophylaxis? So I'm going to forward this question to Dr. Nancy, because Dr. Nancy, can you tell us what is the role of chloroquine? And I want you to also touch base, is there any other treatment options that you think are valid in that context?
Sure. So the chloroquine right now is still under an investigation.
Yes.
So right now, as far as getting prophylaxis dose or getting treated with it, truly, I personally do not think that we need to start that process of going to your physician, asking for chloroquine. I think those, yes, will get depleted if we decide to start doing that, if we did that now. I think those cases should be for patients that are actually admitted in the hospital, who are moderate cases and possibly the severe cases. But once again, it's under investigation. Investigational studies take usually a few years to have that produced. The FDA has to be able to regulate that and the public to get that. There's a lot of different phases that it has to go through. So right now, the treatment options are just supportive care. So for mild symptoms, you need to focus on drinking plenty of liquids at home, taking Tylenol, avoiding Motrin, because that's been associated with a little bit of complication with this virus. If your symptoms become moderate, that's when you need to seek medical attention. Usually you start seeing those symptoms in about 4 to 5 days. That's the biggest problem with this virus, is that you can be asymptomatic and shed the virus. So in 4 to 5 days you should see the fever, the cough. Once you start progressing to shortness of breath, that's when it gets concerning. And that usually occurs in about 7 to 8 days. After you progress to that, it can progress very rapidly. You could end up on life support and end up in the ICU with what we call ARDS. That is a condition that we have treated before. It carries a very high mortality rate, about 30 to 40%. Normally with those patients, there's a lot of maneuvers that we do in the ICU as far as changing ventilator settings, as far as paralyzing them, and even proning them. So if you see a lot of these videos and articles that are a lot of pictures online as far as what's going on in Italy, you'll see them proned, and that's just to recruit more of your lung to oxygenate it. This virus causes a inflammatory response, and with that inflammatory response, you get a lot of fluid buildup, and it's almost like, it's in a way almost like you're drowning, and so the membrane that we have, the alveoli, along with the capillaries that usually normally exchange oxygen, we lose that membrane. And in order to protect you and to fix that, we have to put you on life support and give you time to recover. Normal recovery, usually on average for an ARDS patient, is about 14 days, okay? So if you have one patient in the ICU for 14 days, that takes up that bed. And that's why there's a big concern as far as, yes, this virus is potent, but at the same time, it's the resources that are gonna limit us in helping to control this virus. Like you said, most of us are gonna recover, 80%. Are going to recover. You're going to do just fine. This is
That's
not
very important. 80% of us will recover from it.
Exactly.
But we do want to make sure that people are aware why we are talking about this. It's because of those 20% and what she spoke about, the ARDS. That's why we want to talk about it.
About 15% of that 20% will probably just have moderate symptoms, and Dr. Bajor will be handling those patients in the hospital where they'll get a pneumonia, you might end up on a little bit of oxygen, and then you should be discharged home. But that 5% is where the highest mortality comes from, and that's why we need to limit social interaction so that we have enough beds, so that we have enough ventilators, so that we have enough, PPEs, which is the personal protective equipment that, we go through in and out in those rooms. For one patient in the ICU, the amount of times a nurse has to go in, just to go in to turn a pump off, or a respiratory therapist needs to go and change the vent settings on. All those things require equipment for us, and the more we expose ourselves to that, the more this virus will continue to spread. And as far as therapies, like I said before, yes, they are looking at antivirals, yes, they're looking at vaccines, and then chloroquine as well. But once again, this will not really be available to the public, in my mind, as far as just getting it for prophylaxis, because then there'll be a shortage on the patients that truly benefit from it in the ICU or in hospital setting.
So what I'm gathering from what Dr. Nancy spoke about is that out of 100 people, about 80% of us, meaning 8 out of 10 or 80 out of 100, we will be fine. Some of us, out of the 20, will probably end up seeing Dr. Bijur at the hospital because we're sicker than we should be. And they will probably go through you, Ravi, to get there, and hopefully you'll stay safe while doing this. But once the patient gets to Dr. Bijur and the hospitalist, and if they do a great job, and obviously even the best of efforts sometimes doesn't work. If you're older, if you have diabetes that's poorly controlled, if you have congestive heart failure, atrial fibrillation, end-stage renal disease, or you have COPD, you are the high-risk patient. And if you happen to be elderly who lives in assisted living or something of that nature, it's that patient that will probably end up under your care, Dr. Nancy. And we're talking about chloroquine being used for the patients in the hospital, chloroquine being used for the patients that Dr. Nancy Patel will see. Now, the thing about chloroquine is, yes, it is a good drug to help, but let's not overuse it because there's that fear that we will end up in a shortage that will be desperate. So thank you, Dr. Nancy, for that. Now, let me see what other questions I have from people. When I look down, I do not mean disrespect. I'm looking up for a question, yes. By the way, the next question is, are these tests covered by insurance? And the answer to that is yes. These tests are covered by insurance companies. The new deal with the politicians, the legislature, the senators, and everything that went through with Trump signing it in the last few days guarantees us that any of the tests will be free. The office visits that go along with it may or may not be free. I do believe Medicare has said they will cover the office visit that goes along with it without applying a deductible or a copay or coinsurance. The Blue Cross Blue Shield has not been clear on that. I think Blue Cross of California has said yes, they will waive all copays for patients in California. But we in South Carolina, we do not have guidance. Now the problem here is if a patient gets admitted, that is our responsibility. And that is where, Dr. Vijay, we're going to have to figure out how do we handle the patient and the cost. Isn't that so? Yeah?
Yeah. Well, at this time, no one is looking into whether the insurance will cover it or not. In the hospital system, everything is covered.
Yeah.
And no one asks questions on that.
Yeah.
It's the patient that comes, health that is most foremost.
Yeah.
So.
I agree. Health is first before.
About the hydroxychloroquine.
Yeah. Yes.
This is based on a small study in France, so it's not yet clear whether that has. It's more of a cause and effect kind of thing. So
right.
At this time, we shouldn't be rushing to use that on every patient.
Yes.
We're not doing that in the hospital as yet.
Yes.
And if at all, it would be reserved for patients who are absolutely sick, as Dr. Patel mentioned, and that would be based on more of a compassionate care at that point. And there are other medications besides hydroxychloroquine which are also being.
Like what are other medicines, just to discuss?
Something called remdesivir,
yeah.
which is also antiviral and antiretroviral. That's also being used. It's produced by Gilead, Swiss company. Again, that's also based on compassionate care.
Yes.
And there's again based on small studies in France and Britain.
So there are studies with remdesivir, obviously, and I heard of azithromycin being with the remdesivir. So that and the chloroquine issue, the vaccines. So yes, the research is going on at a war footing, and drugs are being used on a compassionate basis. So if somebody is desperately sick, Dr. Nancy Patel will probably pull out everything she's got, all stops, right?
Absolutely.
Yes, and then the other question we have is, this is for you, Dr. Oza. Somebody's asking, I'm a 65-year-old but healthy. I don't have any medical problems. Should I be concerned? Should I be taking extra precautions? Do I get considered? And how does this whole thing spread?
So that is a great question. I think everybody should be concerned, especially if you're a 65-year-old, even
yes.
if you're asymptomatic.
Yes.
So the recommendation right now from the CDC is that if you have traveled,
yes.
So the recommendation is like everybody should be essentially staying indoors for at least 2 weeks for the foreseeable future.
Yes.
If you have traveled from
yes.
some of the high-risk countries, European Schengen countries, China, Malaysia, Iran,
yeah.
then you should be putting yourself in quarantine, whether you have symptoms or not.
Yeah.
If you have symptoms, then you should put yourself in quarantine and let the healthcare provider know. Now I know that the border, at the airports, they are testing or they are going through a screening questionnaire for everybody coming in.
Yeah.
But if you have not traveled anywhere, you should still be staying indoors, especially if you're over 65. Yes.
So you're suggesting that if a person is over 65, yeah, you need to be cautious, not because you're 65, but everybody should be cautious.
Correct.
And the people that should be the most cautious is the people that are older, and if you've traveled, protect the rest of us.
One thing that somebody asked me recently was, can we play with our grandkids just because they're home? The answer is no. Do not pick up your grandchildren, because we have noticed in this COVID-19 that kids are actually not affected as much for reasons, again, that are not entirely clear. But if they have the virus,
yes.
and if you are over the age of 65, 60, or you have any other health condition, if you get it, then you will be affected. So just stay away.
I'm going to step out.
Do not pick up your grandkids
They're
and
saying something
quarantine
about
yourself.
questions not being answered. Yeah, on YouTube. Okay, thank you so much for that, yes, sir. Without a school, somebody else is asking, is it safe for them to play outside with the other kids in the neighborhood? Ravi, what do you think?
The answer to that would be no, because that goes against social distancing, because, they can be vectors for passing things along at home or to other family members. So I'm not saying they can't go outside and play,
Yeah.
but you gotta keep your distance, just like, they recommend the 6 feet social distancing, so, until this is all kind of settled down, I would play it safe and, stay isolated as much as possible.
So once again, repeating what Dr. Ravi Patel has said, he suggests that it would be better for the kids, even though they're out of school, to do the social distancing bit, but play within
the
areas
airport, they
that
are
we know are
testing, or
safe,
they are doing
essentially.
as well, a
The
screening
other question we
questionnaire.
have is we still are buying groceries, vegetables, and other stuff from the stores. Are they at risk of contamination? Dr. Oza, what do you think is the modes of transmission? This is a good point to talk to us about. Does it go? Is it a fecal-oral route? Is it a respiratory droplet route? Is it a touch? What is this?
So it is a respiratory droplet route, for
Yeah.
sure, that's been established. There is some papers coming out of France again that
Yes.
do suggest that this might have a fecal oral route as well.
Yeah.
So, if you go to grocery stores and pick up vegetables and, standard precaution vegetables, you're gonna cook them well. Those all apply.
Yeah.
But yes, you should wash your hands aggressively, use sanitizers, wash your hands for at least 20 seconds. When you're using sanitizer, you wanna really keep rubbing your hands until the sanitizer dries by itself. You don't have to just put it on there, do this, and that is not the right way to do it. You really wanna keep rubbing until it completely dries out.
I think this is a good point for us to talk about the mechanisms to avoid
Are using Clorox wipes, if remember these things are different, the droplets, they're saying could last in the air for up to 3 hours. They
Right.
can last on surfaces up to 3 days.
Yes.
So truly, you have to keep wiping your surfaces down. If you run out of Clorox wipes, use soap and water with a clean towel, do what you need to. But normally what we do is whenever we bring anything plastic home, we're gonna wipe that down. We're gonna put that away after we wipe it down with Clorox wipes. If you're having any takeout meals, once
Yes.
again, there's risk of contamination possibly there. So it's not the food that we're worried about, it's the equipment or what it's wrapped in. So just be careful, have one person handle the food, wipe it down, wash your hands. After you serve the food, once again, wash your hands again, and then serve and eat, etc.
So I will underline that one more time, just so that we get the point that Dr. Nancy was saying. She herself, of course, because she works at the hospital and she's seeing the high-risk patient, she's coming home and taking a shower, getting rid of her clothes. But when she goes to the grocery store, she's using disinfectant wipes and disinfectant sprays. When she comes home, she's washing her hands. And she also mentioned something very interesting. With all this, we're probably getting a lot more takeouts. We're picking up deliveries, we are picking up boxes at our doors. We need to be careful because the droplets stay alive you said, for 3 hours.
3 hours in the air, up to 3 days on surfaces.
And including cardboard, right?
Correct.
Yes.
So we've got to be careful because the cardboard can hold it for 3 days. So wipe it down, keep it clean, bring it in, take out whatever you ordered, take out whatever the product that's in there, get rid of the box, wash your hands again. That would be the key takeaways from there. So that is good points to learn. And I am going to look up another question that might have come my way. In the meantime, let me ask a question that I see.
Where we're
Yeah.
doing prophylaxis.
Right.
Not right now at this time.
So that would be the thoughts there.
And then there is a question from one of the fellow on the Facebook.
Yeah.
Is there any home test we can do to find out about COVID-19?
This is a perfect spot for us to discuss this answer and also talk about the testing processes, right? So Nancy, I'm going to come back to you about testing, but Sunny, what do you think about the question?
Well, there's no home testing as yet.
Yes.
There are hospitals that are opening up tents and mobile units where they
Yes.
can go and get tested if someone feels that they have traveled to a high designated, level 3 area country, or if they have to come in contact with somebody who has similar symptoms or has been tested
Right.
positive, then they can get to the hospital or they can go to these mobile units and get tested. But there's no home testers yet.
So the good question was there was another question that somebody had forwarded by email about in doctor's office testing, like your flu test and your strep test. Do we have a test like that? I don't think, right, Nancy?
No,
anything?
not at this time. We're really limited as far as what we can the CDC and the
Yes.
government truly releases these tests. I know they're working on these testing, and I'm sure one day maybe they might have a home test possible, but right now I think they're just focusing on trying to make sure that the hospital systems have enough tests. And of course, that'll trickle down to offices eventually, but you always have to be concerned about the population you serve in your offices. I personally, in my office, who I take care of COPD patients and asthma patients, people with lung diseases all the time, to have a test like that in my office would be, sure, convenient, but at the same time, if you're having symptoms of anything that's related to COVID-19, you probably should not come into my office to get tested for that, because that just puts everyone else who's healthy or at least maintaining at huge risk, because they're the ones that are gonna have the severe effects. So I think eventually it'll depend on the individual practice,
Yeah.
but we don't see that happening right now. I really think the government's focusing on just getting everyone curbside service as well as hospitals equipped to test like they're supposed to.
So right now, obviously, the recommendation is as many people as possible to be tested at these big facilities like the South Deck at 701 Grove Road. For personally, I've been using that facility, and I know I'm sure St. Francis probably has a similar setup. I have not heard, but that's the 701 Grove Road South Deck has been my go-to. But you need a valid
more patients or vice versa. So that's one of the process. But I did want to mention something about testing. Now, the gold standard testing is the PCR.
Yes.
And that's sent to DHEC, and that's pretty accurate. Okay.
Yeah.
So the problem with mass production of testing is that like the rapid flu test.
Yeah.
The accuracy goes down. Okay?
Yeah.
So the government doesn't want to put a test out there that's only 50, 60, 70% accurate, because it's devastating to say you're positive when you're not.
Yeah.
Because that changes people's lives.
Yes.
So before they put out a test, I think they have to make sure that the test is going to be accurate enough for us to make clinical decisions on. So I think that's why we're kind of seeing a delay in mass production of these tests that everybody can do at the offices without having to go through this whole process. But from what I hear, I think Roche, one of the pharmaceutical companies, is working on a 4-hour rapid test.
Mhm.
Now, the WHO has a test